Hello there everyone and welcome to another video with Hypnotherapy Training International, and today we're going to talk to Dr. John Butler about his upcoming course, Medical Hypnotherapy. So Dr. John Butler, what is medical hypnotherapy and how you can study that online? Because it sounds a very hands-on course, very hands-on experience course, and a very deep knowledge as well, because it's quite, so maybe tell us, what do you do as a medical hypnotherapist? What kind of things you can do, what the course teaches you, and then how can you study that online? That would be great.
Hello folks. Well, medical hypnotherapy is a very vital part of hypnotherapy. It's been around for over 150 years in the form that we would recognize it, and it has a great tradition. It's been on the periphery of medicine, yet some of the most famous doctors in history, well, in the last 200 years of medical history, have used hypnosis, right down to Freud himself, who was a physician, and he studied hypnotherapy and developed his own system from there, and later came to realize that he needed to include hypnosis again in that system. Now, there's a great deal of validation for the work we do nowadays with modern technology, validating changes in brain activity with hypnotherapy, which play into various systems in the body. So we can begin to see some of the ways in which medical hypnotherapy acts neurologically and physiologically through the immune system, cardiovascular system, and so on. So I've been fortunate to learn from some of the best experts in the field of medical hypnotherapy, doctors who practice this very effectively themselves. There are great benefits for health and well-being generally, even for people who are not ill, but there's a great range of so-called psychosomatic illnesses, where the stressors of life and maybe childhood experiences and other factors in that individual's makeup psychologically have left them vulnerable to the effects of stress. Now, stress is a very complex phenomenon, and how it impacts on the body, it can have multiple effects. We hear of constantly about people with IBS, which is a very common problem in the population. We have people with stress that affects them in their breathing. Whatever physiological problems they have with breathing are made worse, and in some cases the problem is virtually entirely psychological. So stress comes into our bodies. Issues are in your tissues, as we say. Cardiovascular problems often have a big psychological element to them, and we know that depletion of your immune system with fear, worries about illnesses, worries about problems in your life can impact on your immune system and leave you very vulnerable to infections, inflammations, even certain kinds of cancer. So we go into these kind of issues in depth, how to help with physical organic problems without interfering with what the doctor is doing. You can work very much in harmony with Western medicine, and even helping to minimize some of the negative effects of medication and medical interventions. We've helped many people with their surgeries and medical procedures, so we really walk our walk in this area more than probably anybody we know in the field. That's no idle boast. And we've done it in many television recordings, including live recording, hypnosis for pain control in surgery, and helping a person deal with the emotional aspects of surgery, pre, peri, and post surgery. And so we can help people with all those kind of issues. Also, in addition to that, there is a whole lot of areas of medicine where mind-body plays a huge role. And in terms of psychosomatic, yes, well, I've touched on that, but also even in organic conditions long term, there are people who, when we look at their history, it has been the earlier experiences that have triggered their genetic and epigenetic switches that have left them then with a physical condition. Why can we say that? Because we can see that when we compare populations with high levels of adverse childhood experiences compared to the population generally, we see that these people are more prone long-term to even things like diabetes and cancer. Various physical illnesses have a strong link with what has happened in the nervous system earlier on. And so that gives us a lot of help in understanding how mind-body works, that there's a long sequence of biochemical changes can be triggered by stressors over many years. So it's not just the short-term effects of stress, which can be devastating, but long-term as well. So hypnotherapy helps us to deal with the stressors, can take the person back to deal with their illnesses, which they have, the origins of which have a strong psychological component in their history, and we can help them deal with maybe self-sabotage of their health, unhealthy behaviors, and maybe there's some negative secondary gains there, so-called, or even positive secondary gains. They're looking for attention, they're trying to avoid stresses and responsibility in life. All in all, there's a vast range of ways in which hypnotherapy can help people with so-called medical issues, and I hope you will join us on that course and learn, and remembering also that we are the people who teach the work of Gil Boyne, who in the modern era did most with medical hypnotherapy outside of the medical profession. And we have built on the work of Dave Ellman as well, and we're publishers for Ellman and Boyne works. And so on our courses you're going to be learning with supervised hands-on experience, a lot of demonstrations, getting the best learning materials, which I've just touched on some of them there with Boyne and Ellman, and a lot more as well. And so you also have access to a filmed full 60-hour training or 50-hour training course edited down to about 35 hours. We have the live interactive online part, which is somewhere between 20-25 hours. You have all that learning material as well. And so you have follow-up personal sessions afterwards. And we keep the courses to small numbers so that we can give you the individual attention that you need, that is so important for becoming a hypnotherapist. We teach a holistic view of hypnosis, not just one model of it. We are teaching you in depth as well, not a simplistic version of hypnotherapy, one that's profound, that's very therapeutic, psychologically as well as physiologically. So once again, I hope you'll be able to join us on that course, whether you're a practicing hypnotherapist who want to take your skills to the next level, or you're interested in learning about hypnotherapy for your health and well-being, and perhaps helping others around you who don't need maybe years of psychological intervention or anything like that, but who need maybe to learn from you self-hypnosis, waking hypnosis, and other tools we use. So much to learn on a medical hypnotherapy course.
So I let you go, Dr. Butler. This course, it's a very advanced hypnotherapy course. So I guess hypnotherapists and people that working with the mind, with people with the body, but what other professions can join the medical hypnotherapy course, which may be useful to them? I can think of dentists, because as you know, I got to know you through one of the dentists that studies under you, and he's done treatment for my cavities just with hypnotherapy. He didn't use any anesthetic or painkillers, and that was so amazing for me to see that someone can operate in your mouth, where I've got so much anxiety and stress that relate to me. So that's part. But what other professions can come and join a course like that to be help maybe to the patients, etc.?
Well, good question, Idan. We get psychologists on our courses. I have psychiatrists who are physicians, obviously, but are dealing with the mind, and they're using a lot of pharmacological agents which have their role, but they're also wanting to learn how hypnotherapy can help those people in a proper way. Also, for many people with anxiety and depression, so on. Dentists, of course, as you say, we've helped hundreds and hundreds of people with severe medical and dental procedures over the years. And so it's great to see those people coming on our courses. I ran a course for physicians who, well, maybe they're anesthetists, surgeons as well, people who work with people having medical procedures on a regular basis. And that can be anything from colonoscopies to so on, those investigative procedures, or surgeries of various kind. So they can learn a huge amount from this course, and managing people's fears and worries, of course, all of that is so important, and physicians often are not taught enough about that. Patients don't always reveal their anxieties and problems prior to surgery, and see they carry those in at the subconscious level, and that impedes their ability to handle the stress of surgery, maybe delays their recovery, maybe gives them complications, post-operative infections, and so on. So if a physician knows about these tools and knowledge that we have, that they can, through just some very good communications, which is essentially giving good suggestions, through waking hypnosis, and if they have the opportunity and the circumstances are appropriate, the patient wants to learn some very deep hypnotic relaxation of the very deepest kinds that can benefit them for their medical condition and for the surgical interventions. So much good can be done. So this is just, of course, a very quick overview. I could spend a whole, afternoon or day here talking about dental hypnosis alone, because there's so many factors involved in the dental anxiety and dental phobias and so on. So hopefully that gives a very quick summary of some of the professions.
It does. Thank you so much, Dr. Butler. And again, for those watching this online and would like to get in touch with Dr. John Butler, I will leave the email below. Also, if you have any technical fear or doing a course online as well, I will leave both my details and Dr. Butler details, so we can walk you through how this is done, and we can help you set up everything so your learning process is done as smoothly as possible. So once again, thank you so much, Dr. John Butler. I'm looking forward myself to join you on that course. I've done it a few years ago, and it's time for me to recap. So I'll do that as well. And I look forward to another interview with you in the very near future. The next interview I wanted to do on IBS, because your IBS techniques are incredible. And for those who know my personal story, I've got ME and IBS, and one of the things that really helped me get on with my life is treating my IBS with hypnotherapy, which Dr. Butler taught me. So that would be our next interview.
Great. That's walking the walk for yourself. And you're learning to use your hearing power. I'm looking forward to seeing you on that course, Idan. And once again, thanks to everybody for listening and watching.